You know, I'm really glad you brought up that no pain, no gain mantra. I'm so against that, and I can see you are too.
Thank you very much. Not all parents are against that.
I am.
Yes.
It's
yes.
not good.
Yeah, no, not in kids. Their bodies are developing. They can get injured in different ways. They're not a pro athlete that's making $1 million a year that you can inject their knee so they can continue to play on the field. You know, they get injured, and your body is evolved to tell you when something is wrong. And if you don't listen to it and play through these discomforts or pain, you're asking for trouble.
And what advice would you give parents or coaches? And I've seen it where, you know, the child is maybe limping and the child's like, I'm fine, put me back in, go, 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 go.
Yes.
You know, we see it.
Sometimes it is the kid, especially the adolescent kids, that this is their life. The sport is their life. They love it. Their friends are built around the sport. Their whole identity is the sport. It can be tough to tell them to take some time off. But if you talk to them honestly and tell them, you know what, if you keep playing, you may lose a season, you may lose your career if this is something that you are aiming to do. And quite honestly, about less than 0.1% of student athletes ever become pro athletes.
It's less than 1%.
Yes, it's very, very, very small. You know, you have to be well-rounded and do other things, and you know that can also make your life full and interesting.
Right, because if it happens and you are in pain, then if you exacerbate it, what then can occur?
Absolutely. So, tears, fractures, growth plate injuries, and I see it every day, unfortunately.
And that makes just recovery longer. And then once you have one, is it true that you could possibly then, you're prone to having another one?
Yeah, especially if you are playing your sports while you're injured. It'll change your mechanics and predispose to other injuries. Absolutely.